Greetings. This is Dr. Jess, and welcome to the podcast. I've changed the name of the podcast from Ask Me Anything About Anything to Health Hacks with Dr. Jess. Last week we did genes and what they mean. This week we're going to do the pathways and what they mean. So put your seatbelt on, and here we go. First, let's spend a little time reviewing, okay? Like we spoke about last week, genes create enzymes. We know that genetics pass characteristics from one generation to another, but for our purposes, for biochemistry and for our health, I want you to realize that genes create enzymes. Enzymes are what are responsible for allowing our bodies what they take in to create the products that we need. Understand this, genes are unchanging. You can't change a gene, okay? You're born with them. They're unchanging. What you can influence is how those genes, actually enzymes, express. Okay, and we're going to talk a little bit about that today. Let me remind you about the SNPs, single nucleotide polymorphisms. We talked last week they were like highways. The normal, or what is usually green, is a usual enzyme function. Think of it as a 8-lane highway. Heterozygous is about 50 or 60% function. Think of it as a 4-lane highway. Homozygous is like a 2-lane highway, roughly 20% enzyme function. But none of that matters unless there's a lot of traffic. So if you look below the homozygous, you see that the traffic can build up on a 2-lane highway quicker than a 4-lane highway, and a 4-lane highway quicker than an 8-lane highway, but you can have enough traffic to block up an 8-lane highway. What is the traffic? That's all comes down to chronic inflammation, oxidative stress, same terms, okay? And that's from bacteria, viruses, toxins, pollution, and even all the psychological, emotional, and spiritual traumas that we face. They all have a contribution to creating the traffic that blocks up the pathways. And I want you to remember this practicality. The presence of a SNP does not mean you're ill. So just because you find you have SNPs in certain areas does not mean that those pathways are blocked up and you're going to be ill. It's just indicators. And the absence of a SNP does not mean you're well. So just remember the 8-lane highway. You can have a completely normal looking pathway but have enough chronic inflammation to make that pathway not work well. Okay, this week we're going to be doing some of the pathways, and I want you to understand a little bit of it so you know as we put it together next week what they all mean. Okay, so why are these important? What is a pathway? A pathway is a series of enzymes that are created from the genes that turn what we consume into what our bodies need to work. In a pathway, there are many steps, many genes that create enzymes. Hence, it is a real mistake to concentrate on a single gene. You need to look at the pathway. This is something I really want you to understand. The SNPs are indicators. Okay? They're indicators of what may be. Your genes are not your destiny. Okay? So the SNPs are only relevant when it concerns the function within a particular pathway. And the presence or absence of cofactors and coenzymes, which are vitamins and minerals, which determine how well the enzyme is going to work. And remember that enzyme is created by a gene. There's factors that I'll show you that speed up the reaction or slow it down. And the relationship of what is wrong with you and relevant testing to the genetic pathways. That's more for a practitioner to understand. Okay, we're going to use Strategene, which is a product of Dr. Ben Lynch, and it is a great product. And what it does is take the polymorphisms, in other words, your genetic raw data, and put it into the pathway so you can see it. And I'm going to go over that with you today. But let me show you what the various things you're going to see around the enzymes and genes are. And look at the box in the middle. You see gene/enzyme. The cofactor is in green. In other words, you're going to see vitamins and minerals that get that enzyme to work. In the purple, are things that will slow down the activity. In the orange, things that will increase the activity. Go to the bottom left where you see gene enzyme, and it's got a blue line around it. That means the gene was checked and they didn't find anything. When you see a purple in the bar, it means that that enzyme is working slowly. Think heterozygous or homozygous. When it's in the middle intermediate, it's probably working fairly normally, maybe homozygous, but fairly normally. I'm sorry, heterozygous. Okay, and when it's fast, well, it's fast. Okay, and when you have this complicated bar, that's really more for interpretation if you really understand this well, and complicated can go either way. All right, if you see a little green box, it means it was checked, but there's some information about it, but nothing was found. Okay, this is a histamine pathway. By the way, all the pathways you're going to see today are my own. Okay, and what I want you to know here is go to the top where histidine passes by HDC. And for those of you who want to know what that means, it's histamine decarboxylase. When I say something fast, ignore it, please. And it creates histamine. Okay, you see the arrows? It needs B6 to work. What happens here, then the histamine goes into storage, go to the right-hand side, and it's released when one of these receptors, HRH1, 2, 3, and 4, are stimulated. Now, when histamine is stimulated, it's got to be broken down. And it is broken down in two different pathways. You go to the left, and that's the pathway outside the cell. And DAO, diamine oxidase, in me runs slowly. And you can see the products here. The DAO will take histamine and turn it into this big long name that is essentially an aldehyde. Think of formaldehyde. Okay, an aldehyde dehydrogenase, the ALDH family, turns the aldehyde into acetic acid, which is vinegar. That helps. It's a water-soluble molecule that helps get in the detox pathways, or actually out in the urine. The arrows here show you the results of the enzymatic reaction, being the aldehyde, acetic acid, and with DAO, you're also producing hydrogen peroxide and ammonia. Okay? Go to the inside pathway, inside the cell, and off to the little right there, you see NAT2, which works slowly in me, and that creates histamine to acetylhistamine that gets excreted. Then if you go down straight, the HNMT, which uses SAM as a cofactor, and MAO A and B, which uses B2, that creates the aldehyde. And the aldehyde dehydrogenase breaks it down again to acetic acid. The purple that you see, let's say next to the ALDH family, is something that will slow it down. In other words, reactive oxygen species, reactive nitrogen species, oxidized fatty acids, that's all inflammation, aspirin, NSAIDs, and with increasing age. On the left-hand side of that gene, if you look at the upregulating factors, that's zinc, hydrogen sulfide, and vitamin B3, things that will speed it up. If you look at this, if I have allergies and I'm releasing a lot of histamine, it's real clear that I'm going to have difficulty breaking down histamine outside the cell, inside the cell, because the aldehyde dehydrogenase won't work, and even the minor pathway won't work very well. So one of the things I would look for in a patient like myself is difficulty in breaking down histamine, which is going to contribute to ripping open the cell membranes and so forth. Okay. This is my folate pathway. Now, folate is part of the methylation pathway. It's not it's not all methylation, okay? If you just go straight down, the SLC19A1 is what takes folate out of the gut and turns it into DHF, dihydrofolate, and eventually THF, and then all those fancy names. But if you go down, you see it's complex, and everything works slowly. So I'm going to have a lot of difficulty creating this big molecule called 5,10-methylene THF, means tetrahydrofolate, okay, which methylene tetrahydrofolate reductase, MTHFR, turns it into 5-methylfolate, which is what our bodies use as a folate, which is needed for a whole mess of different reactions. Notice that the cofactors here are NAD, which is B3, and ATP, which means you need a good mitochondrial function for it to work. And I'm not going to go into all the other cofactors here, but if I look at this, I'm going to say to myself, I'm going to say about this patient, myself saying, wow, methylation doesn't work very well. Again, this is an earlier version of Strategene. Okay, on the left-hand side, you see that the folates and green leafy vegetables, and you see all the enzymes, and you see yellow, which is heterozygous. Okay, then it goes down to THFR. And if you look at the right-hand side, you're seeing where cobalamin goes in, like hydroxycobalamin, adenosylcobalamin, cyanocobalamin. The cobalamin is the B12, the adenosyl and so forth. Those are carrier ions. And with cobalamin, the co is cobalt. Okay, that's your B12. It goes in at MTR, goes through the cobalamin pathway, goes past MTRR, and then becomes methylcobalamin, which is what our bodies use as B12. But look at the MTR. Things that can slow it down are nitrogen oxide, NO, lead, mercury, hydrogen peroxide, acetaldehyde, which is aldehyde, is like nitrous oxide, cadmium, aluminum, copper, and alcohol. So a lot of things can slow this down, okay? And of course, in the MTRR, you need SAM, B2, and B3 for it to work, whereas MTR needs zinc. So it gets a little complex, but if you want an enzyme to work, you have to at least provide it with the cofactors that it needs to work. Okay, this is my entire methylation pathway. And the reason I wanted to show you this is, number one, if you look at it just generally, you see a lot of purples. Okay, so my methylation pathway doesn't work all that well. Okay, the methylation pathway, the whole purpose of it is to create, where you see that red line, SAM. Big word is S-adenosylmethionine. Okay, and what that is your major methyl donor, which goes around the body and puts methyl groups on various structures in the genome, so your body works the way it's supposed to. Methylation is not just folate. It's not just methyl B12. Okay, this is the entire methylation pathway. And with me, you could say, well, he's going to have some problems here under an oxidative stress load. But some people, they look at MTHFR and say, oh, my methylation is not working. Not necessarily. Okay, this is my dopamine pathway. Okay, and if you look at the dopamine pathway, tyrosine to L-dopa at the top there, and then it goes down and creates dopamine, and that gets broken down by MAO and COMT and a few other things. And clearly, I'll have difficulty breaking down dopamine. Now, that means that the dopamine may get very high. And when that happens, you can have symptoms of anxiety, anger, OCD, ADD, and so forth. Okay. Now, one of my sons, has a very similar pathway to me, and has schizophrenia. Why don't I? Okay, it's all a matter of what's stimulating the pathway and how much. Okay, and you can see what you need here, things like serotonin, GABA, SAM, B6, B vitamin C, so forth and so on and so on. Okay, you have to know what actually pulls the trigger, but when you're doing this, you're not going to give somebody all these vitamins individually. So when I first started doing this, I created something called fundamental treatment, which is giving somebody very absorbable vitamins and minerals and letting the body put it where it needs it. Okay, it would be foolish to try and give somebody all these various B vitamins and minerals and so forth separately. Okay, it's not sustainable. Okay, so when I look at this, when I look at the pathway, I say, gee, what could be going on? Where does this point me? And that's how you interpret. Okay, so in summary, I want you to know that the pathways are a series of enzymes created from genes that turn what you consume into what your body needs to function. Okay? All polymorphisms should be considered as part of a pathway, not by themselves. A pathway with polymorphisms might, and I say might, slow down the production of the products that you need to heal and to function, but only if there's traffic. And I say that very clearly because it doesn't matter how many polymorphisms, how many SNPs you have. You're not ill. When you were a baby, you weren't ill. Unless you were. Okay? You weren't ill. Everything worked. It's the accumulation of the traffic. It's the accumulation of oxidating compounds, which is chronic inflammation, secondary to a whole mess of other things, the spike protein from the COVID jabs, viruses, bacteria, Lyme, so forth and so on and so on and so on and so on and so on. That's what creates the traffic, and that's what creates illness. So we can concentrate on the genes, but the genes are just pointers, things for you to consider. What you need to do, and this is why I'm going to teach you next week exactly what to do. This is how you heal. You heal by getting rid of the traffic. And I'm going to tell you a little secret. Do you know why a lot of people don't do this? Because it's too simple. And because it's not sexy, because it's not complex, people don't do it. Practitioners, I mean, they don't do it. They don't recommend the proper stuff. And I'm going to go through it next week. Don't worry about it. Just stick with me and you're going to learn a lot of stuff. But we have to get rid of the traffic, and then your body will work the way it's supposed to. And concerning genes, remember the caution that I gave you last week. There are tons of programs out there that will lead you directly to products. Okay? You can't determine what somebody needs just from the genes. You have to put a lot of things together. Their symptoms, what, if they're absorbing. It doesn't matter if you have polymorphisms in the neurotransmitter pathway. You can have nasty things that say, oh, they should have a high dopamine. Then you take a dopamine test and it's not high. The reason is they're not absorbing their amino acids. They're not absorbing any cofactors and coenzymes. Okay, so when you submit your raw data to one of these programs and they tell you what products to take, there's an inherent bias there. Okay, and I suggest that you don't trust those programs because they usually have been skewed towards a pharmaceutical and nutraceutical protocol. Okay, so I hope you got all of that and I wasn't too wordy. As usual, I would like you to subscribe to my YouTube channel. Okay, tell your friends because I think this information is great. You can email me if you have questions at office@drjesarmine or preferably jess@drjesarmine.com. If you want to see if I can help you with something that's been bothering you, go ahead and go to my website and you can schedule a free 30-minute get acquainted phone conference. Why should you treat with me? Well, I'm very well educated and experienced. I've been a healthcare provider for 5 decades, and I'm the doctor that will give you the time and empathy you need. And as always, if nobody told you they love you today, Dr. Jess does. See you next week.